But joining me first is Chris Jennings. Chris is I hope he would say this, a longtime friend. And we disagree on solutions, and that's okay. But I think we agree on a lot of the problems. But he is a longtime friend. He's advised multiple presidents. I would say he was one of the chief architects of the Affordable Care Act and its implementation for President Obama. And he worked in the Senate side, I won't hold that against him, for a long time and did a lot of good work there, and is now president of Jennings Policy Strategies. So Chris, you want to join me up here and we'll have a little discussion. Thank you.
Go here.
Either way. Like
this is the fair and balanced part of the...
The whole day is fair and balanced. So, all right, Chris, you're a well-known Democrat. I'm a less well-known Republican. Let's level set here. With the GOP sweep in the last election cycle, we've got a very active president. We've got Congress passing budget resolutions. You and I have lived through these kinds of environments before. Some of it's a little new and novel in terms of how things are happening. But how do you see Democrats kind of regaining their footing and maybe pushing back against Trump and Congress on some of the things they're talking about in the health space and outside the health space?
Well, I mean, the Republicans are in power. I've seen it, felt it. We're reading it every single day. And there's only so much some Democrats can do on Capitol Hill. Obviously, we're seeing on some already perceived to be overreaches on the regulatory administrative side. That's going to be handled first and foremost through the courts. We're going to be watching that very carefully. We're going to see if there's a constitutional crisis. We all read the papers. We all know that. It's kind of interesting because I think there's been a realignment of both the Democrat and Republican parties. This is the Trump Republican Party. This is not the budget-conscious deficit reduction party necessarily.
Not the Mitch McConnell party.
It's not the Mitch McConnell party for sure. And it definitely has, if you watch directionally, I think they are nervous about health care. They're almost as nervous about debating Medicaid as Democrats want them to debate on the Medicaid program. And that's very different than we saw even in the 90s. And you'll recall in the 90s, and that we did engage in fights around that, and that's when it was a real budget issue. Now we're talking about substantially passing a huge tax cut, which will substantially increase deficits and debt, which, by the way, will increase more pressure to cut Medicare, Medicaid in the downstream. So I'm trying to figure out who this Republican Party is, actually who we are fighting. But I do think they're nervous about Medicaid, and I think you've seen that even in the passage when they passed the budget resolution, how they've been talking more about what they're not going to do than what they're going to do. And so that signals to me a nervousness about engaging on that front. Having said that, if you have $500 billion in cuts, at least, they have $880 billion, so if you pick your number, you tell me what number will be on health care, it will be the largest cut in the Medicaid program in the history of the program. There's no provider or plan that I know that they think there's overcompensated under the Medicaid program. There's no governor who thinks that they can afford substantial cost shifts to them. And so I think it's going to be a hard road. And I think that, to your point or to your question, that will allow Democrats to engage in a very significant way in every debate around the budget resolution around health care. And I think it's going to make some Republicans nervous over a period of time.
So, but do you put credence on what President Trump has said and said, we're not going to touch Medicare, we're not going to touch Medicaid?
Yes, he has said, what did he say? He loves and cherishes. It's a beautiful thing.
Beautiful program.
Whatever. Yeah. I don't know what I think he loves and cherishes the program.
You can't do the imitation.
But I'd say that The president says a lot of things that sometimes are somewhat contradictory.
I guess the right question is, can energy and commerce, can finance hit an $880 billion target without going into Medicaid?
No, it's impossible. It's math. There's no way they can get that number without a significant cut. In fact, that's what I'm saying. It will be the largest cut in the Medicaid program if they do anything as close to that. And I think it's important that we say, when you do that, no matter what policy you pick to do that, that is a substantial reduction in the dollars available from the federal side to the states. So that is a huge cost shift to the governors, and I think you're hearing the governors already signal, wait a second, we're for you, but we're not for this. And I think we're going to hear more and more about that. We're going to hear from plans and providers who are going to say, hey, you cut that deep, we're going to have significant coverage losses, and we're going to have pressures to reduce benefits in significant ways. And I think that over time, and we all know, anyone who's been following this, if you do this as part of a package that is a significant tax cut for billionaires, but also, more importantly, for people maybe in this room, it will substantially increase the debt and the deficit. And so there'll be huge pressures downstream to cut Medicare and Medicaid and the ACA downstream. So the reason why Democrats are so opposed to this policy is not just health care, it's economic and budgetary as well.
Yeah. But help us understand something. And this is a bit off script.
Yeah.
But Democrats aren't suggesting we shouldn't do anything with Medicare and Medicaid. There's appropriate reforms that should be made. There are cost reductions that could
absolutely,
be
absolutely. And I say this all the time. Any Democrat who takes the position that we should not constrain health care costs is actually undermining their own commitment to covering people, because you can't afford coverage if you overpay for coverage. Okay, that's going to increase premiums. That's going to increase cost sharing. That's going to increase the inability of people to be able to afford health care in the first place. So they're making a huge mistake if they don't. But this particular policy is a one-shot deal on Medicaid that is an excessive cut in a package that will lead to even more cuts, that will lead to more coverage loss, that will lead to more out-of-pocket costs. That's not the prescription that Democrats want to support.
Yeah. Are there specific issues or reforms you think Democrats could support?
Sure. I mean, we would love to build on pharmaceutical cost containment. There's no doubt about that. There's a whole set of delivery reforms that people are interested in. I think there's bipartisan interest in looking at consolidation of the marketplace, both plans and providers. I think J.D. Vance is someone who really wants to look at that. When you have market practices that limit purchasers' ability to even know what you're spending money on, and you don't have the transparency that you can see to make thoughtful choices about which entity is going to best serve your own members, then it's a huge problem. And I think Republicans and Democrats can agree on a lot of these policies. I absolutely do. But that's different than picking on one program, cost shifting it to the states, and putting it in a package that's going to increase the deficit.
It seems like competition and transparency are the two areas with the most bipartisan support.
I think so. I mean, I think there's some Republicans who'd like to do more on pharmaceutical cost containment, and you can define what that would be. But yes, I think that, and I think there is interest in looking at other areas as well. I believe you can look at managed care, you can look at physician payment reforms. There's a lot of different things, and I agree with your comment about a commitment to prevention, management, and ultimately treatment of chronic illness. I think that's another big area where there's real opportunity for bipartisan agreement. It's just that right now we're having a debate around the budget resolution, which really is using health care as the tail to wag the dog.
Yeah. Did you agree with my assessment that access to care and Medicaid is not great and we need to approve it?
Well, I mean, we have a lot of people on Medicaid, so there's a lot of access to care, and I would say we can always improve Medicaid just like we can improve the commercial sector. But if we want to compare and contrast how much people are paying in healthcare writ large per capita, if you do apples-to-apples comparison, the commercial sector is actually spending a lot more money on healthcare. So I don't know if people want to do the comparison about pricing, but again, drivers of cost also include the price of the care that we're purchasing. And sometimes I think Republicans think that we'll just let individuals try to negotiate with certain entities to lower prices. And I think Democrats generally think, hey, they're not leveraged very sufficiently. I think individual employers think they're not leveraged very sufficiently to constrain costs. And I think we need to do better for all of them.
So do you think then healthcare is the footing that Democrats use to regain some leverage on Trump and the Republicans? And
you know,
just gonna
Democrats will use whatever leverage that we have. We have limited, but yes, absolutely. I think healthcare, as a general rule, the public historically has trusted Democrats more than Republicans. Democrats historically are uncomfortable talking about healthcare. I know other than you,
we're bad at it.
And they tend to do it through the prison of costs, not care, and policies, not people, and budgets, not outcomes. And so Democrats aren't great either. Don't get me wrong. It's just that we all need to do better on the messaging. And I agree with you. Cost is the driver. I think it's actually two things, though. It's cost and complexity. Those are the two primary issues that drive the public's frustration with healthcare. And I'm okay with more options and choices, Joel, but I'll tell you, there's a lot of people who feel that it's just confusing and complex. And when I have more options and choices, I still can't navigate through the healthcare system when I need the care that I need. And whomever does that better, whether it's public or private or commercial or whomever, will be the one who ends up winning.
Yeah. I get confused whenever I try and order at Panera.
Panera's easier.
It's a tough menu.
Panera's a lot easier than healthcare.
So do you see, like, we've got start of the budget process. You and I have been through the budget process. It's this is really the hard stuff is on its way.
Yes.
What they've gone through is the easy stuff. But the March 14th deadline, we've got debt limit, which Trump wants to push outside of his presidential window.
Yep.
That seems like a lot of leverage Democrats have because there's Republicans who just won't vote for funding the government.
Yeah, I mean, I think Democrats do have some leverage on both the continuing resolution and on the debt limit. But that's precisely because there's a cohort of Republicans who just don't want to vote for those policies. I think if you're a governing party, you should be responsible for keeping government alive and around and available and accessible to people. And my general view is whomever's in power they get the credit and they get the blame. And that's what's going to happen. So Democrats, I think, can use some of their leverage in that regard. The thing about our party, though, is that we also fundamentally believe it's reckless to not pay your bills, and it's reckless to close down government. So that's going to be an internal tension within our own Democratic Party about how best we apply that leverage in that debate. I think you're right to say, because you're so experienced, that budget resolutions are much easier to pass than the specific policies to achieve those, particularly when you can just say, no, it's not going to be that, it's not going to be that, it's not going to be that, it's not going to be that. Well, at some point, they're going to have to say what their policy is. And usually when policy is exposed, it gets scrutinized, and it's hard to defend. And if you really haven't done your homework about constructing policy that is workable and sustainable, you're just standing on quicksand. I say that to Democrats and Republicans. If you don't do your homework, no message is going to save you.
So where is that bipartisanship this Congress? Is it around the ACA subsidies?
I see that down. I mean, as a part of a broader agreement, I think that, it's very interesting about APTC. This is the Advanced Premium Tax Credits and the Affordable Care Act that have been increased over a period of time to ensure affordability. Coverage expansions have ensued. Providers are happy, and now, in states that haven't expanded Medicaid in particular, Florida, Texas, et cetera, they're enormously reliant on them. And so from strange places, you're going to hear a desire to get some of that done. And it should get done. And that would be one of the areas that Democrats could and should use their leverage to do some of that. I presume that there'll be Republicans who say, okay, maybe, but let's talk about, do we reform any of it, et cetera. So we're going to have to see where that goes. But yeah, I think In some of these vehicles, there'll be leverage to do that. And yes, healthcare would be one of the priorities of the Democratic Party. I would think, of course, I'm not part of the Democratic leadership, so far be it from me to say, but that's one of the few issues that people understand.
Yeah.
My costs are going to go up if you don't change it, you know. And it is, remember, 2026 when those costs would go up. It is the election year for the midterms. It's not an easy one to say, under my watch, premiums went up X%.
It's amazing they chose that year for those expirations.
It's really amazing.
It's amazing.
Although
it's
I
amazing.
want you to know, we would have been preferred to make them permanent.
Yes, of course.
So.
Yeah, of course. So I wanted to, I could talk to you all day. Wanted to open it up to any questions in the audience. This is
There's one back there.
Yeah, all the way back there. We've got a mic.
I wanted to ask about the lifetime cap on benefits. That was one of the main selling points of Obamacare, was you didn't lose coverage after $1 million lifetime limit, and one of the selling points for Republicans is they might try to block grant it, so some states might not use it for health care at all.
So I think the repeal of the lifetime benefit cap was significant, right, for some people.
Yes, yes.
And certainly there was a cost associated with that, but it provided some stability and certainty, I think, for a lot of people in the marketplace.
I think one thing to talk about a little bit about this, that just to put this in broader context, elimination of lifetime and annual caps has been really important. It helps on the catastrophic side, and in fact, one of the least understood benefits to the provider and to the manufacturer world is that there is that protection now. People aren't exposed as substantially as they otherwise would be. Now, I will say, even with those caps, we do see an amazing number of people that still file for bankruptcies as a consequence of healthcare expenditures. And under the Medicare program, under the MA program, we do have caps, out-of-pocket caps, but we don't have it for the traditional fee-for-service program. So that is another area where people are really interested in focusing on reforms in the future. I'm sure this will not be a Republican priority, but it is something that may be part of a broader reform, which I see downstream. I think you're going to see, in this period of time when there's lots of polarization, there's also time where people stand back and they look at broader reforms, and I think those are real possibilities for thinking downstream. What we all both, I think, know, we're going to require some additional reforms for the commercial space, for Medicare and for Medicare, to be able to afford it and sustain the programs and their support.
Yeah, and actually surprising, we tried to do it a couple times, enact a annual benefit limit in fee-for-service in MMA, in the 2017 bill, in the 2012 bill.
Yep.
So, I think Medicare, written in the 1960s when probably most people in this room weren't alive, except for a few like me.
Well, I'm alive. I was alive.
I realized my mistake when I said it.
Maybe I won't be alive as long.
But that the 99 Commission produced the Part D benefit,
yep.
Right? And we've got a lot of experience with D and how premium support works, and that was kind of a mini model for ACA. And so I think there's maybe some learnings that we can take to the drawing board. Probably not right now, though, right? Like, when does the era of bipartisanship hit? And we'll make this the last question.
Yeah, I think, having been around for a while, and I've been doing this for now 40 years, you never know. You always need to be prepared for it, because there's no accounting for the time when something is possible, and particularly if it's for an issue that is under the top line level, you can get a lot of things done: mental health care, opioid stuff. I think physician payment reform this year is an area where there could be some bipartisanship. One thing that we have to recognize, and this happens with Republicans and Democrats, when the two parties are at odds very hard, in very conflicting ways, and there's overreaches where there's no bipartisanship, in other words, like this is going to be a Republican-only package, it does filter into the environment for receptivity for bipartisanship. So if it's all jam and I'm not going to work with you, then there's a tendency not to be able to collaborate as even when you might otherwise won't wish to see it. But I also know that Democrats are always starving to do policy, and that's who we are. And so there will always be opportunities, and then particularly in those areas. And I think, look, we haven't even talked about workforce issues and AI issues and a lot of other things that I think many people are quite interested in. And so I do a lot of work with the Bipartisan Policy Center, and we are always trying to develop some sort of environment for and possibility of reforms downstream. And frankly, except for this big Medicaid debate, which it's going to be pretty much war, I think. There's not going to be a lot of common ground. After that, anything's possible, particularly after we win.
Excellent. We'll leave it there.
Okay.
Thanks, Chris.
All right.